Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin. The world of technology and healthcare, ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. And today we're going to be discussing our Health IT Mount Rushmore, and this is part one. We're going to do part two in the next episode, but lots to talk about, so we had to do 2 episodes. And be sure to follow the show on the social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 20 years of health IT content at healthcareitdaily.com. Have you ever been to Mount Rushmore, Colin?
I have not. It is on my list of things and places to go. I've never been.
Yeah, me either. It's on the list. I almost went with my brothers. We were planning a brothers trip and we were going to go there. Then we decided to bring my dad, who can't move as much. And so we're like, no, let's change it. So it's still on the list.
I mean, I've only ever seen it in movies. I mean, I see it in movies all the time, you know.
Is it going to be, that's interesting. Like, if I go, am I going to be disappointed? I've already seen pictures of this. I don't know.
With the last movie I saw it in, I mean, it was National Treasure 2. So I'm wondering, you know, do you drain the lake? Is there some hidden treasure back behind there or something? That's going to be kind of fun. Yeah.
That's true. That's what I've seen it most in movies where they're hanging off the nose or something. Yeah. Yeah.
Anyway, yes, this should be an interesting episode. Yeah, I think we're going to, first of all, I think it's going to be very interesting. And second of all, I think it's going to be interesting to see who is not on the list as much as who is on the list.
Yeah, I think people are going to revolt on social media. So I'm looking forward to that. I can't wait to hear where people tell us we're wrong and what we missed. That's likely as well.
Yes, but that makes for good engagement, as we all know, right? But
I'm interested to hear what they say and what I forgot.
All right. Well, let's get down to it. Let's get right to it, John. Who should be on the Mount Rushmore of health IT technologies? So not specific companies, but just technologies in general. Who would be on the Mount Rushmore?
Colin, you're going to love this one. It's going to make you sleep well at night when you hear it. And everyone else listening, I know you're going to love it too, because you still use it and you still are part of it. And that is, I'm leading off my Mount Rushmore of technologies with the facts.
I mean, with the facts.
Don't get angry. I know you want to ask the facts too, and you're sick of them. And to be fair, I don't like sending faxes anymore either. But if you were to look back at the history of healthcare IT, fax was interoperable, in the 80s or something like that? I don't remember when fax started, but it was early. So interoperability of health information was being shared on fax for decades before we even had EHRs, I think, so like, why are we knocking something that was so transformative in its day? Now, do we need to move on beyond it? Probably, right? Do we need to move to digital fax? We already have, right? Like, do we need to improve the workflow on top of it and maybe find some other directories that are better than fax and more accurate and more discrete? Sure. But if you look at the arc of a healthcare technology, fax has to be on the Mount Rushmore.
Okay. I can't argue with you. It's on my list too, of being on Mount Rushmore. Obviously the protocol has survived. The machine, I think that's the part that all of us can do without. I think
how resilient is that protocol? Like, think about that. Like,
that's the thing for me, is like the protocol and the mechanism. Like, everyone had a fax number, and that number corresponded to a practice usually. And you could dial that number, send something to them, and they would get it, like just using the standard protocol. Now, these days you don't want it. Very few of us have an actual machine anymore. Mm-hmm. So that's gone away, and thankfully that's gone away. But the protocol, it's still used, and there's still modern versions of eFax, and other technologies that make that unstructured data useful now. And so I would definitely say I agree with you. It deserves to be on the Mount Rushmore.
And the thing that's gone is thermal paper.
Yes.
I think we can all agree we don't need thermal paper faxes. I don't know if you remember those, or you leave it in the car, it becomes total black, or oh crap, I can't read anything.
It's funny, like we complained about it during the time. Like, I remember those days fondly, like the thermal paper and then loading them and just undoing that little sticker piece that drag that piece out and cut it off before you put it through the machine. But it had a built-in compliance because it would fade after like 6 months, right? Like you couldn't read it.
Consider that a compliance feature.
It's a compliance feature, right? Like because we all knew if you didn't do that, if you didn't copy it onto a real piece of paper, like with a photocopier, which you also had, then you would end up with, a black sheet of paper after a time, or it would just be so crinkled and crumbly that when you picked it up the next time, it would fall apart in your hands, right?
Yeah, I mean, it's fascinating to think about. I was even talking with my wife about the facts this week, and it's like, wow, how is this still lasting? Is the interesting part. But again, I go back. It's on the Mount Rushmore, not necessarily for what it's doing today, but what it did 20 years ago, which I think is still incredible.
Yeah. Well, for me, an equally old technology that I think deserves to be on the the health IT Mount Rushmore, pagers.
So, you're putting the pager up there?
I'm putting the pager up there because that was the only way, other than the PA system, to get a hold of somebody. Like you needed someone right away. And we got pretty creative in the way we started using pagers, right?
I was going to say,
right? Like it became like the early text. Like you could, if I paged you with this code, it meant this, and that code, it meant that. Like everyone had those systems. Everyone had to memorize these codes that were specific to the organization. And then only certain people had them because they were at the beginning super expensive, right? Like, and you had these protocols that you had to put in place of which pager you would send under what conditions, right? And so it got us started down the path of thinking about communication triage and real-time communications and things like that, which we never had before. So it's up there for me. And of course, that led to all the things we have today, like texting and so forth, which we now, of course, we use that all the time in healthcare.
Yeah, I'm a little torn, right? Because you're right. It was so core. I mean, even look at TV shows, right? Where the pager was like such a part of it and did require like a different language to understand. Like, what does that page mean? It's interesting. Was the pager the start of physician burnout? Because they had the pager literally sleeping with them so that they could get paged at night to come in for an emergency, right? Like, was that the start of kind of like, ruining the boundaries of physicians to have them come in at all hours? And that's what started this trend of like burnout and, trouble that we have of, keeping boundaries with it. I don't know. So I might give it a little knock for that. But the other interesting thing from a tech perspective, the pager was quite reliable. And they had to build their own infrastructure to make the pager work often. And that's actually the problem today. Pagers don't work today because we don't have that infrastructure. We haven't invested in it, and we shouldn't invest in it. We should do secure text and other things like that. So anyway, that's an interesting one. Wow. The next one that I would offer is actually the internet itself. Just having the internet. I was talking to someone just this week, and they're like, yeah, I was part of the organization where we're like, should we have a website for our hospital? It's like, that was a discussion at one point, and would we want one, and would that be valuable? Now that even just that idea is like, if I were to ask my kids, they'd be like, wait, why would a hospital not have a website? But, that was an interesting discussion. But more importantly, the internet allowed everything that we're doing now, all of that connectivity, all of that communication, all of the data sharing that should happen and is starting to happen and is happening more and more. Like, if you didn't have the internet, all of that other stuff, as beautiful it is to document in a local database or something like that, right? On some Unix system into the thing, the internet just transformed what we could do in healthcare. And so it needs to be on my Mount Rushmore.
I mean, yeah, I think that would be on everyone's Mount Rushmore of technology in general, right? Without the internet, we wouldn't be doing half of what we do today. Most of the jobs we have today wouldn't exist, right? There would be no such thing as a social media or anything like that.
And some say, would that be better?
We could argue that we could argue, but the fact that we people can make a living off of that these days would have been unheard of at the beginning of the internet. So it's hard to disagree with you on that one. And I would say the websites alone have transformed healthcare, right? Just in terms of information sharing, of being able to do things on it, like patient portals and booking appointments and finding out whether or not what services are available. I mean, those are all incredible things that are only possible now through websites.
You didn't like searching through the insurance book to find a doctor that probably can't see you, and you have to call 10 of them to see if they're available.
I know, and isn't that crazy to think about? It wasn't that long ago, right?
It was in our lives, which is crazy too.
For me, I'm going to go way back. This is going even older now for me, beyond pager, even older than that. If you remember way back in the day, the vacuum tube delivery systems in hospitals.
Wow.
I would put that on the Mount Rushmore of health IT for two reasons. First reason, when you look back at the history of the internet and networking in general, that was the inspiration, because essentially what now we know as TCP/IP addresses, that started its concept with the numbers you punched into those vacuum tube systems to identify a destination. So that packet essentially went from A to B, and you had to have an address for A to B for that system to know how to route the thing. So that is the essence of modern networking, and that was what the inspiration was the vacuum tube systems. And the biggest users of those vacuum tube systems were actually, well, other than the military, was hospitals, because they would use these systems to deliver medical records, right, which were handwritten at the time, or test results, or eventually one day samples, but that came later. But you would put those things in the tube and you would type in the department, right? This needs to go from radiology to somewhere else. And you would type that in, and they would go back to the ward, or the nurse would send a request down to X-ray and let them know the patient was coming. And so that became the basis for inter-organizational communication, which then, of course, the pager came along and fax and all that stuff. But to me, without those vacuum tubes, we would not have the modern internet, we would not have networking, and we would not have that interdepartmental communication that we now take for granted.
Interesting. I did not expect that one. That's interesting. And it's interesting to see the evolution of that now with like Intuition Robotics creating a humanoid robot to do what the vacuum tube did, right? Like essentially transport stuff. It's a much more dynamic. You don't have to address it the same way, and it can go wherever it wants. VC has one from telehealth as well, so it's interesting how far that's come. That same principle, though, of I need to transport something somewhere else. That's interesting. I actually saw some company that was talking about a vulnerability in the tube system and how it turns out your tube system can be breached. So even today, it's still here delivering something, right? So it's interesting how the tube system has survived. So yeah, that's a powerful idea. My next one is actually e-prescribing.
Oh, wow. Okay.
I mean, I look at it and it's like, everyone universally understands the value and we all benefit from it. Now, is there work that needs to be done? Yes, it gets set in the wrong place and things like that. But the fact that my pharmacist doesn't have to say, what did your doctor write here? I mean, just that alone deserves Mount Rushmore, because it's like, no, it's clear. This is what they prescribed because it came across in a way I can actually read it. And so, that's powerful, but also just the ability that it's there and I can just go and pick it up. To me, it's the most interoperable part of healthcare, area. And it's a wonderful solution in so many ways.
Well, and my last one before we go to break I got to go with this one, the electronic health record. I mean, that's got to go on the Mount Rushmore I mean, without that, well, first of all, we wouldn't have a whole industry of interoperability, for one. Some would argue we never should have had that industry because it should have been interoperable from the beginning. But I mean, the EHR is now the foundation for so much, right? It's the repository of information. It's the source of billing information. It's what is now making possible AI in healthcare, right? A lot of that data was stored in those systems. So, I mean, I would put the EHR up on the Mount Rushmore of health IT.
Ooh, for my fourth one, I'm going a little out there, and it's a little bit ambitious because it's still happening, but I'm saying the AI assistant, including the scribe, ambient voice, every sort of AI assistant out there. Like I said, it's the most exciting thing we've had since the $36 billion of stimulus for EHR. Your EHR to make Mount Rushmore needed money. The AI scribe and assistant is going to happen on its own. So it's still in process. So but forward looking, I think it's going to be worthy of it, and it's going to make it on my Mount Rushmore.
Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are discussing our health IT Mount Rushmores. This is just part one of potentially two parts, maybe even three, who knows, that we're going to have to go through here. We're getting into some really good and interesting debates. So, John, let's go to the next one. Who should be on the Mount Rushmore of health IT people?
The first name that came to my head, it was the easiest name to come up with, and I might slaughter his name because it's a hard name to say, but is Neil Papadopoulos. Who he deserves credit for essentially founding healthcare IT and the EHR world that we know. And, he just passed away. So, I hope his family understands the value of their father and the family, like what he accomplished. He essentially built the foundation of MUMPS, which Epic is built on. And he also built Meditech as a company. And so between those two things, he built what we now call health IT and what we now call EHR. So, in my mind, Neil is the founder of health IT and everything that we're talking about today as one of the very first people to do this in a hospital organization. He came out of MIT. He saw the opportunity. He worked at a hospital. He saw, I think it was Mass General, if I remember right. He saw that they could use technology, and he went off and he built all of it. And I mean, literally, when I say he built it, when he was starting Meditech, he built their own email system. He built their own phone system. He built all of that because that was the only way to run a company back then, was to build all of that stuff so you could serve the customers, let alone the fact that he built a lab system and a pharmacy system and a EHR and everything that was related. So to me, Neil is the top, as really the founder of everything that we did.
I mean, hard to argue with you there. I mean, after reading his history and some of, the what his work has highlighted by others, I mean, it's hard to argue, right? I mean, This is that, creating an EHR at a time when we didn't even have that word, right? Like, think about that, right? Like, that word didn't even exist yet. That's pioneering, for sure.
And the people were saying, why would I want this?
Yeah, well, exactly. Like he talk about pioneer, true pioneer. He had to fight where people, just kind of scratch their heads and go, this is so weird. Like, why would I do this? And
he pioneered essentially that freemium model.
Yeah.
He's like, let me just put it in for free, and if you like it, you can keep it. As I understand it, that was how he started, because they weren't convinced that it would actually be valuable.
That's going back. Okay, so for me, my first nominee, if you will, to go on the Mount Rushmore, I have to go with the first head of the ONC. I got to go all the way back to Dr. David Brailer.
Wow.
I think everyone, his accomplishments are sort of more mythical at this point, right? Because he was the first head of that newly created agency, or that new created group under President Bush. But for me, it represented a point in time where we were finally getting coordinated, truly as what the name represented, coordinated in healthcare. Because before this, it was so fragmented and there was no visibility at the government. It was very hard to get visibility at the government. And so this represented the first time where we had some hope of, okay, let's get some stuff going now, right? And he laid the groundwork, in my opinion, for a lot of the things that would come later, right? Like especially in terms of the big funding announcements that came out years later. Some of the foundations of interoperability and data sharing, like these were all started at that time. Now, I'm not saying he'd created it all. I'm not suggesting that, but he was there when we could finally bring a lot of the people who had been harping for this together and start working on it.
He is, I think, the most interesting national coordinator we've ever had, although Farzad gives him a pretty good run for his money.
That's
as
true.
well.
Farzad is pretty, Farzad up there in terms of
they're
fun
both
people.
up there is fascinating people and fascinating insights and perspectives and everything. Even post national coordinator, he's an interesting person to hear from. That's interesting. And ONC deserves a lot of the credit, right? I mean, certainly Blumenthal and Farzad had the onus of distributing the stimulus, of doing the certification. So they did a lot of the work. But the bravery of, was it Bush and Brayler, I think, if I remember right, that kind of started that so that then they could. Because, you have to remember the HITECH Act, it came out of the RS stimulus package, and they were like, this is my perspective on how they built the R1. Is like, where can we spend money? What are the shovel-ready projects? And there was this HITECH Act to stimulate EHR, and they're like, oh, that looks shovel-ready, and they didn't spend $1 for 2 years, but they put it all together. But it was like, it came out of that, and if that wasn't there, then it wouldn't exist. And EHR adoption, imagine that if we hadn't spent the $36 billion of stimulus money, where would EHR adoption be today? I bet it would be in like the 50%, 60%. I don't know.
Well, and you think about, I mean, again, we're not kind of getting off topic here, but like you think about the industries that investment created. Like you think about how many people are employed in health IT today because that stimulus money made happen. Like I think we would have eventually got there, but we would be probably 10 years behind where we are now. If that money hadn't been there, like we wouldn't have the companies we have today because the data wouldn't be there to leverage it. So I look at that and go, you talk about having the right outcome. Like, even though at the time we could debate how it was distributed, whether it should be distributed for those reasons and blah, blah, blah. The point is that these whole part of the health IT industry just wouldn't exist had that not happened, right? To your point.
I mean, even think about, I interviewed someone from Aledade, Farzad Mostashari's company, and I was like, yeah, you're doing incredible things, but if you didn't have all the data from the EHR, you wouldn't be able to do what you're doing. Like having the data there made that possible. That's interesting. Well, I'll throw one out that might be a little bit of a controversial pick, and I might be slightly biased because as healthcare IT today, we like interesting. And so maybe this is biased because of that, but I'm going to throw Jonathan Bush out there as one of the most dynamic and interesting people that impacted the industry through his voice and through his ability to kind of cut through the BS and call it the way it was. Now, sometimes he said some BS too, but the fact that he was able to do that, and he built a really exemplary EHR, Athena Health, with unique models around revenue cycle that were pretty unique at the time. Luckily, he was smart to partner with very good tech people to execute it, so he was able to do that. But his ability to reframe and call out the industry and push it forward and push forward initiatives, to me, lands him on the Mount Rushmore of people.
Every industry needs its maverick, right? And he was it for a long time, still is, I think, in some circles. He was the one who broke the mold of a way a CEO could act, the way a company could perform. He was the rebel, and you're right. I mean, he, just for his character alone, he helped bring attention to the industry.
Now, he did some other things that may get him off the Mount Rushmore of it, just like they got him off his company. So there was some controversy, but I credit him for what he did accomplish and the way he woke up a lot of us to what was happening in the industry.
Well, it wouldn't be a Mount Rushmore debate if there wasn't some debate, right? So that's, hey, like this is what we hear. So my next nominee for the Mount Rushmore, I got to go with Don Berwick. So Don Berwick, for two reasons. One, he has done so much pioneering work for the improvement in terms of performance of healthcare, right? Through IHI and other organizations. So he was the head of that for a long time. He's still involved. So he really pushed the patient safety side, which is so needed. And, there's a whole industry around patient safety. It's now something we talk about that needs to be baked into a lot of the solutions that we provide. And he was one of the people, along with Nolan and Whittington, that coined the triple aim, which has become the quadruple aim, which has become the quintuple aim. So you think about how many companies use that today, health IT companies use that today as a foundation for their strategy. And that alone, I think, it makes him worthy of being on Mount Rushmore, just because he created something that now every company has baked into their strategy for how they develop their product. It's got to help patients. It's got to reduce costs. It's got to help physicians. It's awesome. And so I think Don Berwick deserves to be on the Mount Rushmore.
Wow. I'm going to choose one that maybe is not as familiar to some people, but I love Dana Sellers. She founded multiple companies, including Encore Health Resources and one previous to that. And here's why. And I think she highlights the epitome of what makes health IT incredible. I was at an event one time, and she was telling me the story about the start of health IT and using punch cards at a hospital. And you think about, that breadth from, implementing punch cards at a hospital through implementing a modern EHR. She's somewhat representative of a entire category of people, but she did it in the right way and did the hard work of implementing it and of working with the people who didn't want this technology in some cases. So anyway, that's where she gets credit to me and is that exemplary person in health IT who had to do the hard work to make it a reality.
My last one I'm going to nominate is Ed Gerner, a name that only a few people will maybe remember, but in 1961, I believe, he founded what eventually would become HIMSS. And so without him, we wouldn't have HIMSS. And without HIMSS, we would not have the place where a lot of that money, first of all, went to try to attract people when we had the big spending, but also just, HIMSS for a long time was the only place where health IT gathered. It was the only society where people who were pushing the envelope, who were doing work, back then under MUMPS and other initiatives like that, lab management systems and so forth. That's where they would go. And that was the only place for them. And I hear the stories from Jane and Shorshan Khan and others who were at those early HIMSS meetings. And just to hear, there was a group of 100 of them, right? And getting together and trying to come up and push the government to implement policies and spend a little more. And anyway, without that vision to create a society like that, we would not have the HIMSS that we know and love and get frustrated at today.
Yeah, that's fair. I've heard Ivo Nelson talk about those early days and how that's changed as well. It's interesting. So for my last one, I was thinking about doing Larry Weed, the inventor of the SOAP note and documentation and things like that. But I decided instead that I just couldn't do this without Judy Faulkner, right? I don't think anything else needs to be said. Epic is powerful, influential, and has accomplished so much. And it really influences so much of healthcare today. Judy deserves hardcore credit for, maintaining her approach and building a successful company. So credit to her for sure.
Yeah. Hard to argue with that. She definitely deserves to be on it for what they've accomplished as an organization and how much influence they went out wield over our industry. So, well, we're at the end, John. This has been fun. I can't wait for part 2.
Yeah, absolutely.
Well, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hong, along with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.